This presentation is part of a 9-part mini-series on healthy aging, brought to you by Pacific University's PhD Clinical Psychology program in the Memory Evaluation and Measurement Research Initiative Clinic. So this presentation is talking about brain health and wellness, different ways to love your brain. And so we'll start by talking about what brain health really means. So brain health is really cognition. Cognition is just referring to our general thinking process. And as you know, our brains have a huge variety of abilities. These abilities can be broken down into a handful of various domains to describe the different functions that we're capable of. Our cognitive functions include functions like language, memory, thinking speed, and attention. You can think about cognition as brain health. When we keep our brain healthy, we can continue to do the things that we've been able to do as usual. Maintaining brain health can help prevent cognitive decline. And there are normal changes that do occur as we age, but some changes that are unwanted can be prevented by practicing brain health, and it's never too early to start. So first, let's talk about what's normal. And when we talk about normal, we're really just talking about the average, what we expect to see based on a normal trajectory without any influence of disease or problematic processes. Our brains are plastic, meaning that they continue to change based on our experiences. So normal aging does include cognitive changes. Some things change while other things stay about the same and we maintain, and it's entirely normal. So within cognition, like I said, there are a number of different domains or areas. And so while some things do change, we maintain a number of abilities within the same domains that we see some change occurring. So for example, when we're looking at intelligence, when we measure it and we talk about it in psychology or in the realm of cognition, we're really just looking at general abilities or accumulated knowledge. So what we see that stays over time and stays with age of a normal trajectory is crystallized knowledge. And this is really knowledge that we accumulate over time. What changes, though, is what's called fluid intelligence, which is our ability to solve novel problems outside of what we already know. This is something that changes, and we expect it to change. With memory doesn't change altogether, despite thinking, popular belief that we lose our memory as we age. What I'm calling long-term memory stays. And these are memories that we've had for a very, very long time, well established from our childhood, young adulthood, things like that. But what can change is newer and one long-term memory. So forming new memories can be tougher, as our ability to store new memories is impacted by factors related to age. And so to distinct long-term from long-term, when I'm looking at long-term, it's anything from before about 2 minutes. So still in what you might think of as short-term memory. With attention, we tend to maintain attention when we're able to be focused on what we're working on. What gets harder, though, is multitasking or divided attention in some way, so we're more easily distracted. Within language abilities, in general, language tends to stay. Our verbal abilities don't change as we age, but finding the words that we want to say can become harder. Our ability to problem solve changes somewhat, in that, like with general abilities, intelligence, as you can see, the first one there that we talked about, the old ways of doing things stays, while adapting to new contexts can be a little bit harder. And lastly, processing speed, or how long it takes us to perform other cognitive functions, changes. So the ability to perform tasks doesn't change necessarily, but it just might take a little bit more time. And this isn't comprehensive of brain health with age, but it gives you an idea of what normal aging might look like and how within many of our cognitive processes, there are these sub-processes that can be impacted differently. So some might stay and others might change. Cognitive change can can occur as a result of disease like dementia, but it can also occur as a result of a number of external or internal factors that we often forget about. So again, we should expect some changes to occur with normal aging. But we should also keep in mind that some medications have cognitive side effects, like pain medications, Benadryl, or various prescription drugs. They do have unwanted effects. And with age, we are more vulnerable to certain medical conditions, which increase our likelihood of being prescribed to various medications, which then in turn may have an impact on cognitive abilities. We also often forget about how much our sensory system changes, how much that might play into what we think our cognitive ability changes. So sensory changes, like not being able to hear or see as well, can play a role and impact our ability to then learn and remember things. I mean, if you don't hear something, you're not going to be able to remember it if you never learned it. Health concerns can also impact what we think of as cognitive abilities. So, for example, if we have chronic pain or migraines, things like that, that can really affect our ability to concentrate. And then changes in mood as well as our mental health, these things can play a big role. In regard to our mood, research has shown that we're more likely to recall mood congruent stimuli, so things that are the same as how we're feeling. So if we're feeling happy, so positive things we'd be more likely to remember. But then in general, we're also more likely to remember negative stimuli, which is kind of a protective factor. And then when it comes to mental health, when we're experiencing symptoms of anxiety, we're pretty likely to experience selective attention. And if we're experiencing depression, we're also susceptible to impaired attention. And if our attention is impaired, then it makes it more difficult to learn things, which then how could we remember something if we've never learned it? So research continues to suggest that we can reduce the risk of cognitive decline by incorporating certain habits into our lives. And the more of these habits that we incorporate, the better. It's never too late or too early to incorporate healthy habits. This list of ways to love your brain is adapted from the 10 Ways to Love Your Brain guide that's published by the Alzheimer's Association with some additional tactics and research. I added active because we are active agents in our lives, and these are all ways you can be active in promoting brain health in your own lives. So this lecture will touch briefly on a number of ways that you can love your brain, but if you're interested in diving deeper into these topics, we'll cover many of them in following presentations that will be recorded. All right, so I'll start here with eating well. You've heard it before. Eating a healthy diet is linked to wellness across the board. So incorporating a balanced diet that is higher in fruits and vegetables and lower in fat content, but not excluding fat entirely, has actually been shown to reduce the risk of cognitive decline. A great resource for this is choosemyplate.gov. It offers tips and information about how to incorporate a healthy diet into your life depending on your demographics, whether you're a student, an older adult, a middle-aged adult, that kind of thing. Also resources for children. So we've heard about specific diets and diet fads that promote health, but research for these specific diets and cognition is somewhat limited. But there has been some promising research that shows the cognitive benefits for the Mediterranean and Mediterranean DASH diets, and DASH is dietary approaches to stop hypertension. So the Mediterranean diet emerged in the 60s when the heart health of individuals in the Mediterranean area, primarily Greece and Italy, was observed. And so what's observed in this diet is really opting for whole grains, incorporating far more fruits and vegetables than most of us are probably eating, so aiming for 7 to 10 servings a day, using healthy fats, so maybe subbing olive oil as a replacement for butter if we're cooking, eating more seafood, so eating fish twice a week, reducing our intake of red meat, maybe subbing with fish, poultry, or beans, enjoying dairy in moderation, so really just small amounts of dairy products. And also doing your best to limit salt, so using spices and as a substitution for salt. So the next one, again, nothing you've never heard before, um, but regularly engaging in cardiovascular exercise, specifically that elevates your heart rate and increases your blood flow to the brain and body, has been shown to be critical for brain health. So staying physically active is one of the ways to prolong vitality, and being active increases overall health, improves cognitive alertness, is linked to greater life satisfaction, increased psychological well-being as well. It also strengthens bones and lowers the risk of falls, and we'll talk more about falls and protecting your head from head trauma later on in this presentation. So over time, aerobic exercise has been shown to increase the volume of the hippocampus, which is an area of our brain that's critical for learning and memory. So some examples of things that we can do, especially in older adulthood when there might be concerns about different conditions or physical health. Things like swimming, brisk walking, dancing, yard work, housework, gardening, climbing stairs or hills. It doesn't have to be going to the gym. It doesn't have to be CrossFit by any means. Just thinking about what you can do that you enjoy that also gets your heart pumping. So research also indicates that physical activity even stimulates growth and neural connections. So it is critical for maintaining brain health as well as brain growth and brain development. This was this lecture series was initially put on during social distancing orders from COVID-19. So I included this virtual fitness activity that was going on at a local, the Juanita Pool Center here in Oregon. So you don't have to go to your gym to be physically active. You can see what's going on online in your local community. So evidence shows that many of the same risk factors for cardiovascular disease, like obesity, high blood pressure, and diabetes, also negatively impact your brain health. Uncontrolled chronic illnesses or conditions, in many cases, are linked to cognitive decline, dementias, and Alzheimer's disease. So better brain health is associated with better heart health is associated with better brain health. So take care of your heart and you're taking care of your brain. And no surprise, many of the ways to take care of your heart overlap with taking care of your brain, such as being active, not smoking, and consuming a healthy diet. It's also recommended that you visit your doctor at whatever recommended interval your doctor has decided, and get regularly screened for conditions that impact overall wellness and brain health. Another thing you can do to love your brain is be a lifelong student. So formal education is actually a protective factor against cognitive decline, meaning that those who are more educated tend to have a lower risk of cognitive decline. And so this can look like taking a class at a local college, at a community center, or even online. There are free online versions of many popular classes from universities like even Yale and MIT that you can take. And continuing to learn doesn't have to look like taking a formal class. Reading is also a great way to engage your brain. And regardless, by reading, taking classes, or even learning from a friend, engaging your brain by learning something new. This is what we're talking about, so things like trying new hobbies, learning a new language, taking an art class from a community center. Do something to learn, do something to learn something new and challenge your mind. Maybe even do puzzles, play games like chess and bridge that require you to think strategically. Challenging your mind, learning something new, they have short and long-term benefits for your brain. So not getting enough sleep due to conditions like insomnia or sleep apnea may result in problems with memory and thinking. Consuming caffeine or alcohol, using tobacco products, and poor sleep hygiene may also prevent restful sleep. If you do have sleep apnea, which is a sleep disorder in which your breathing actually stops momentarily during your sleep, make sure to follow your physician's recommendations, like using a CPAP. Uncontrolled sleep apnea may actually lead to reduced blood flow to the brain and subsequent cognitive impairment. And good sleep hygiene is something, it refers to behaviors and routines that help promote restful sleep. This includes things like regular exercise, just not right before bed, a comfortable sleep environment, and not eating a heavy meal or drinking too much before bed, avoiding caffeine, avoiding alcohol, and avoiding smoking. Staying socially engaged may support brain health too. Pursue activities that are meaningful to you, like spending time with loved ones or getting involved with your community. Consider volunteering, getting involved with a local community or senior center, joining a group that supports your hobbies, like a choir, being active with friends or family, or spend quality, undistracted time with your partner. So even now, when we need to socially distance, you can stay social with technology by video chatting or calling loved ones. I've seen a couple people or a couple groups who have started virtual book clubs. There's a lot of ways that we can continue to stay social despite some of the barriers that have been put up. Another thing you can do to love your brain is just knowing what medications you're taking and the effect that it has on your brain. So some medications have unwanted side effects, which can be amplified and even more dangerous for older adults. Common unwanted cognitive side effects in medications may be sedation, delirium, or falling. So common medications that are recommended to use with caution include Benadryl, certain anxiety or depression medications, some muscle relaxants, some medications for IBS, and there are others too. And so ultimately speak with your physician about medications and unwanted side effects. In this case, brain health might just be knowing what you're taking and what the side effects or interactions are and how it relates to your cognition. In addition to increasing the risk of many health problems like diabetes, high blood pressure, heart concerns, excessive alcohol use is also linked to cognitive impairment. The way we metabolize alcohol changes as we age. For older adults, the effects of alcohol are generally felt much quicker than when they were younger, putting them at a higher risk for injuries or falls, as well as increased memory impairment. But not drinking at all may not be the best case. Research has actually shown that some alcohol, being about 1 to 6 drinks a week, not all at once, but maybe once a day or so, is a protective factor against dementia, actually promoting better cognition. But again, check with your physician about how alcohol might interact with some medications. Otherwise, no alcohol at all might actually not be the best case. Something I think we forget about is protecting our brain physically. So brain injury can actually raise your risk of cognitive decline and developing dementia. So do things like wearing a seatbelt, using a helmet, and taking other steps to prevent brain injury like falling. So use balance aids like canes, walkers, railings, or wall handles if balance is a concern for you. And when you walk or you move, be mindful and aware. Distracted moving may lead to losing your balance. You can actively practice balance with movements like practicing Tai Chi, yoga, and stretching. And Tai Chi specifically has been shown to be very effective in increasing balance among older adults. Loss of strength may also play a role in and loss of balance. So you can counter this with strength training if that is the healthy choice for your body. It's also important to take care of your mental health. So stress can happen at two levels. It can be acute or chronic. Acute stress is a daily stress, like running late for an appointment. But when stress builds up, or when it lasts a long time, it turns into chronic stress, which has a lot of negative effects on our health. Stress impacts our health and wellness, as well as our ability to think clearly. So managing both daily and chronic stress is important for overall brain health. Mental health can also impact cognitive functioning. Depression can impact reaction times and memory, and anxiety can impact attention. There's a lot of stigma around asking for help, but if you're experiencing mental health symptoms, getting the support you need is a huge way to love your brain. Practice regular self-care. And self-care is so much more than treating yourself to a dessert or taking a bubble bath. Self-care is a way to sustain yourself and take care of yourself. And you can do this by regularly practicing self-compassion. Start by thinking about how you would treat a friend or your child or your partner. When you care about yourself, you take care of yourself. And self-compassion has also been shown to be huge in positive aging, associated with meaning in life and positive emotions. You could also try practicing gratitude, maybe by starting a gratitude journal in which you write down at the end of the day or the beginning of the day 3 things that you're grateful for, thankful for, or even sharing your gratitude for someone else with them. Gratitude practices are a great way to manage stress and increase psychological well-being. You can also practice mindfulness, which is really just being aware in the present moment. It doesn't have to be a lengthy meditation, but simply really just checking in with yourself to see what you need. Informal and regular mindfulness practices are strongly linked to overall brain health too. So overall mindfulness is linked to emotional well-being and cognitive health in areas like attention. So all of these have been shown in the research to increase psychological well-being and mental health. And I know we didn't get to talk about them too much. So if you have questions, feel free to reach out to us. And our email will be at the end. Another thing you can do that we wanted to talk about is getting baseline testing done. So participating in cognitive testing allows you to understand more about how you're thinking. So more about how you're functioning currently compares to peers of your same age and demographic. Even without specific concerns, participating in cognitive testing can help you establish a baseline of your current cognitive functioning. By doing so, you will have the information to compare and monitor change over time for early detection of any changes that you might be seeing in your thinking. So the MEMRI Clinic, and the Memory Evaluation and Measurement Research Initiative, this is through the PhD program in clinical psychology at Pacific University, where offering, we typically offer 3-hour cognitive and neuropsychological assessments for free. And then we do 1-year follow-ups that see change over time. But due to social distancing orders, we're currently offering free virtual screens. So our email is here, and you can reach out to us if that's something that you're interested in, just to get a baseline understanding of how your functioning is. So because we are located in Oregon, we wanted to include some Oregon resources that are specific to older adults or to Oregon, being the Washington County Crisis Line, the Aging Disability and Resource Connection of Oregon, the Senior Loneliness Line and Senior Connection Calls, which are relatively new and specific for older adults. There's also some national resources here in case you're not local. And I do like to remind that all of these lines are staffed with people who are volunteers or paid, but ultimately their role is to be there. So they're they're paid to be there, volunteering to be there to talk to you. And so if you need to call, please call. So that was looking at 12 ways to love your brain. So we have a handful of other presentations that we will record and post. Otherwise, check our resources. Otherwise, our email is here. We're pacific.memri, MEMRI, clinic@gmail.com. And please reach out to us if you'd like a copy of the slides, you have questions, or you'd like to sign up for a free virtual screen. Otherwise, thank you for joining us.